It's a common condition that causes pain or tingling in your hands and wrists. We're talking about carpal tunnel syndrome. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Edward Chan, orthopedic hand surgeon at the Queens Medical Center, West Oahu. Good morning, Dr. Chan. How are you doing this morning?
Good morning. Doing very well. How are you?
I'm doing excellent. Now, first off, what is carpal tunnel syndrome?
So carpal tunnel syndrome happens when there's excess pressure over the median nerve in the hand and on the wrist. And so pressure over this nerve leads to symptoms of numbness, tingling, and pain in the hand, and in severe cases can lead to weakness and loss of the muscle. Most cases of carpal tunnel syndrome are what we call idiopathic, meaning there's no known exact cause, and it is a very common condition. Some associated risk factors that can be associated with carpal tunnel syndrome include diabetes, rheumatoid arthritis, pregnancy, and other conditions.
Now, doctor, how is carpal tunnel diagnosed?
So carpal tunnel syndrome is typically diagnosed with a thorough examination and a history taken in the office. Oftentimes, electrodiagnostic studies can be ordered to help confirm the diagnosis and to help gauge the severity. This is a test where they put a bunch of electrodes on the arm and run some electrical currents to test the activity of the nerve and muscle. And this is typically done by a doctor called a neurologist or a physiatrist. Sometimes we also can inject steroid medication into the carpal tunnel and use that as a diagnostic tool as well.
And finally, what are some of the treatment options if you suffer from carpal tunnel?
The simplest treatment for early and mild carpal tunnel syndrome is to wear a wrist splint every night when sleeping. And the reason for this is that excessive wrist flexion or extension leads to exacerbation of the symptoms. And most of us, when we sleep, our wrists are usually not in a straight position. They're either flexed too much or extended too much. If symptoms persist after this, then injecting steroid medication into the carpal tunnel can sometimes relieve symptoms and can be used as a diagnostic tool, as mentioned earlier, but the relief can be temporary. If symptoms still persist after this, or with severe cases where there's weakness and permanent numbness in the hand, then usually surgery is recommended. And this is a surgery called the carpal tunnel release. There's various techniques you can use, but the bottom line is that it's a very common, quick outpatient same-day procedure. That is one of the most common procedures that we as hand surgeons perform all the time. And most patients are very satisfied after surgery.
Now, to learn more about the Queens Orthopedic Surgery Department located at the Queens Medical Center, West Oahu, you can just give them a call at 808-691-3520. Thank you very much, Dr. Chan, for your time, and have a great day.
Thanks. You too.